Good morning. My name is Didier Leys. I am professor of neurology in Lille, in the north of France. We are here in Barcelona for the ESOC meeting, and it's my privilege today to interview Edo Richard from the Netherlands, who was a key investigator of the preDIVA trial. Edo, good morning. Can you explain us what is the background of the preDIVA trial?
Yes, thank you, Professor Leys. The background is that about 10 years ago, together with Professor Pim van Gol, the principal investigator of the preDIVA trial, and Dr. Eric Mol van Charante, key investigator as well, we thought that treating vascular risk factors to prevent dementia would be a good idea. That came from the reason that we know that vascular risk factors, such as high blood pressure, high cholesterol, overweight, and lack of physical exercise, actually pose an increased risk on developing dementia later in life. So we thought, what if we treat these risk factors for dementia in older people, would we then be able to actually prevent dementia later on in life?
What was the objective of the preDIVA trial?
Well, the objective was to see if we can give a long-standing intensive vascular care, so treating risk factors for dementia to people in the older age range, above the age of 70. We wanted to prevent dementia over a 6 to 8 years follow-up.
Could you give us the main results, and the methodology first and the results of the trial?
Yes, of course. We invited 3,500 persons from the general population in primary care practices, and we asked them to participate in our study, where we then randomized the people, so half of the people got standard care as usual, and half of the people were treated by intensive vascular care, which was provided by a nurse who addressed all risk factors for cardiovascular disease and dementia in 4 monthly visits. That means treating high blood pressure with medication sometimes, but also giving lifestyle advice on a healthier lifestyle, a healthy diet, and how do you propose to do more exercise.
What are the main results of your study?
Well, the main results is that after 6 to 8 years follow-up, we could not prove that dementia can actually be prevented by this type of intensive vascular care. And although on the first sight that might seem disappointing, I think there were some signals in our study that perhaps the contrast between the treatment group and the group who got standard care was not large enough, probably because the level of healthcare in the Netherlands is already quite high, so it was very difficult to actually improve the standard care for this type of risk factors. And we did see that in those people who had a very high blood pressure and were never treated before, the treatment might actually be effective to prevent dementia, but we were not able to show that definitely.
Did you see an effect on the risk of stroke or MI or death in general, besides the effect on cognition?
Surprisingly, we did not see that. We actually expected that we would see, in addition to an effect on dementia, we would also see an effect on stroke and myocardial infarction, and also on mortality. And I think the reason we did not find that might be the same reason why we did not find an effect on dementia, because the contrast between the standard care group and our intensified care was probably not large enough.
What may change in our practice after your trial? Could you explain what could be the future?
Yes, I think the future would be that we look at countries in the world where the level of healthcare is perhaps not at the same level as a country like the Netherlands. For instance, in upcoming economies, we see that the burden of stroke, myocardial infarction, but also dementia is expected to rise dramatically over the next decades. And also risk factors for these diseases, such as high blood pressure, obesity, and lack of physical exercise, are increasing dramatically. So I think if we want to really try to improve global health, I think this type of intervention will probably be more effective in upcoming economies.
Do you agree if I summarize your results by saying that having a very strict control of all vascular risk factors failed in your trial to show an effect, except in a few patients who were not very well treated before? And the reason for that is probably that the level of care in the Netherlands is very high, and it's difficult to find an effect in this case. Do you agree with this way to analyze?
I agree with that, and so in addition to extending this type of research to less developed countries, we could also focus on specific groups at high risk in countries with already highly developed healthcare systems.
Thank you very much for your answers.